Have you ever stopped to think that something as simple as the color of your skin or hair loss could be trying to tell you that something is not right with your kidneys? It may seem like a counterintuitive statement, but the truth is that the signals your body emits can be more revealing than you imagine. And, if you are neglecting these symptoms, you could be at greater risk than you think. After all, who would have imagined that the health of the kidneys, such a vital and often forgotten organ, could be reflected on the outside? The point is that when it comes to kidneys and health, every detail counts. From a simple swelling to a change in nail color, everything can be an important clue to identify problems before they become irreversible. And the best part? By paying attention to these signs and acting quickly, you can not only protect your kidneys but also significantly improve your quality of life. And that, my friend, is a reward worth the effort. But don't be fooled, the journey to understanding and caring for kidney health goes far beyond the obvious. And that's exactly what we're going to talk about today. Get ready to dive into knowledge that few share, but which can make all the difference in your life. Early detection matters. When it comes to health, many people overlook the subtle signs that the body gives, especially when it comes to the kidneys. The skin, for example, can be a faithful mirror of internal health, revealing problems that have been developing for some time. Changes in skin color or texture can be warning signs, indicating that something is not right. Detecting these signs early can be the difference between keeping your kidneys healthy and facing serious complications. Paying attention to these small details and seeking medical advice when something seems off is a crucial step. Imagine that your skin begins to show inexplicable changes, such as spots or excessive dryness. This could be a direct reflection of a kidney problem that is already affecting other parts of the body. But unfortunately, many only realize the severity of the situation when the symptoms become undeniable and, often, irreversible. Here, the key is to act quickly. Monitoring skin health and being aware of symptoms is one of the best pieces of advice any health specialist could give. After all, prevention is always better than cure. Therefore, if you notice something different on your skin, even if it seems insignificant, remember that it could be an important sign of your kidney health. It's not just about aesthetics, but overall well-being. Consulting a doctor for preventive exams can not only protect kidney function but also improve overall quality of life. Kidney health is closely linked to what we observe on our skin, and understanding this connection can be a powerful ally in the early detection of more serious problems. Chronic kidney disease prevalence. Kidney health is often underestimated, but the reality is that more than 800 million people worldwide may be living with chronic kidney disease, CKD, without even knowing it. This makes awareness of symptoms and risk factors, such as high blood pressure, diabetes, and obesity, essential. Imagine the number of people who could avoid serious complications simply by knowing these risks and acting early. The importance of taking good care of the kidneys is as vital as taking care of the heart or lungs. However, most people only discover they have a kidney problem when the situation is already advanced. CKD is a silent disease that develops slowly and quietly. For those with risk factors, such as a family history or pre-existing health conditions, vigilance should be doubled. Regular exams may seem like a simple task, but this practice can make all the difference. As they say, knowledge is power, and being informed about kidney health can save lives. Therefore, those who are in risk groups should adopt preventive measures, such as monitoring blood pressure and keeping a strict control over blood sugar levels. Small lifestyle changes, such as adopting a balanced diet and engaging in physical activities, can have a significant impact on kidney health. Awareness of CKD and its implications is the first step in combating this condition that silently affects millions of people. Itchy skin, pruritus. The persistent sensation of itching, or pruritus, may seem like just a trivial nuisance, but for those suffering from kidney problems, it can be an important warning sign. About 40% of people with end-stage renal disease, ESRD, face this uncomfortable condition, a result of the accumulation of toxins in the blood that damaged kidneys cannot adequately filter. Living with constant itching affects not only the body but also emotional well-being, disrupting sleep and the quality of life of those dealing with this situation daily. For many, the itching caused by kidney problems is more intense at night, which further aggravates the discomfort. Imagine trying to sleep with a constant sensation of invisible bites that don't go away, no matter how much you scratch. This condition is more than just irritating, it is a clear sign that the kidneys are not functioning as they should. In such cases, seeking medical treatment is essential, as controlling the itch can significantly improve quality of life. Managing kidney-related pruritus is not just about using creams or lotions, it's about addressing the root of the problem. This may include dietary adjustments, the use of specific medications, and, in some cases, treatment of the underlying condition affecting the kidneys. Understanding that itching is a symptom of something larger helps to shift the perspective on kidney care. After all, kidney health directly reflects overall body well-being, and taking care of them is essential to avoid more serious complications in the future. Rashes. When the kidneys are not functioning properly, one of the signs the body may give are rashes, which are often underestimated. Rashes can appear in various forms, but one of the most associated with kidney problems is acquired perforating dermatosis. This condition manifests as small bumps on the skin, which, in addition to itching, cause great discomfort. These skin lesions are not only aesthetically undesirable but indicate that something more serious may be happening with the kidneys. The appearance of rashes due to kidney problems is often ignored or treated superficially, with the use of creams or ointments. However, it is essential to understand that these rashes are an external symptom of a deeper internal problem. Therefore, when noticing changes in the skin, especially when they appear without an apparent cause, it is important to consider the possibility of kidney dysfunction. Consulting a specialist may be the key to treating the problem at its root, instead of just masking the symptoms. Taking care of the skin when dealing with kidney problems involves more than just topical treatments. Maintaining adequate hydration and following a diet that helps alleviate the burden on the kidneys are fundamental steps. The health of the kidneys and skin are interconnected, and treating both in an integrated manner can prevent future complications. Therefore, when observing a persistent rash, remember that your body is sending signals that should not be ignored. Blisters. Among the lesser-known signs of kidney problems are blisters that appear on the skin, especially on the hands, forearms, and, in less common cases, the feet and face. These fluid-filled blisters are more than just an aesthetic inconvenience, they can leave scars and discoloration on the skin after healing, indicating an underlying kidney problem. For those living with kidney disease, these symptoms can be frightening and frustrating, as they affect not only physical health but also self-esteem. When these blisters appear, they are often mistaken for allergic reactions or common dermatitis, which can delay the correct diagnosis. However, it is crucial to understand that the presence of these blisters may be a sign that the kidneys are not filtering the body's toxins effectively. Upon noticing the appearance of these lesions, the best course of action is to seek medical advice to investigate kidney function and understand the severity of the situation. This type of symptom, although rare, should not be overlooked. Dealing with blisters caused by kidney problems requires special care that goes beyond dermatological treatment. Avoiding trauma to the blisters and keeping the skin clean and hydrated can help reduce the risk of secondary infections. More importantly, it is essential to treat the root cause of the problem, which is often directly linked to kidney health. The connection between what we see on the skin and what happens internally should not be underestimated. Taking care of the kidneys is taking care of the entire body. Calcium deposits, calciphylaxis. Calciphylaxis is one of the most severe complications associated with kidney problems, and it manifests painfully on the skin. This condition occurs when calcium accumulates in the blood vessels, leading to the formation of extremely painful sores and ulcers that can turn into areas of necrosis. For those dealing with calciphylaxis, the quality of life can be drastically impacted, not only by physical discomfort but also by the emotional challenges that accompany this severe condition. This accumulation of calcium in the vessels is a direct consequence of the imbalance in minerals that healthy kidneys usually regulate. In individuals with kidney problems, the body cannot keep these levels under control, resulting in complications such as calciphylaxis. Unfortunately, this condition is difficult to treat and often requires a multidisciplinary approach, including dietary adjustments, specific medications, and, in more severe cases, surgical interventions. Early diagnosis can make all the difference in managing this condition. For those facing this situation, skin care becomes even more crucial. Preventing infections and open wounds is a priority, as is finding ways to relieve pain and improve healing. Although calciphylaxis is a rare complication, its impact is profound, reminding us of the importance of keeping the kidneys in good health. It's not just about avoiding disease, but ensuring a life with less pain and more quality. Dry skin, xerosis. Dry skin, or xerosis, is a common problem in people with kidney dysfunctions, especially those on dialysis. This dryness occurs because damaged kidneys cannot maintain the proper balance of minerals and fluids in the body, which directly affects skin hydration. For those living with this condition, the skin can become rough, scaly, and prone to cracking, increasing discomfort and the risk of infections. Often, xerosis is treated with topical moisturizers, but it is important to remember that this is only a temporary fix. The real challenge is correcting the internal imbalance that is causing this symptom. Staying well hydrated, consuming a balanced diet, and following medical guidelines are essential steps in controlling xerosis. Additionally, adjusting the skincare routine, such as avoiding very hot showers and using mild soaps, can help minimize the effects of dryness. Taking care of dry skin is an important part of overall kidney health management. Although it may seem like a superficial problem, xerosis is an indication that something deeper is occurring. Ignoring these signs can lead to bigger complications, so it is vital to pay attention to what the skin is trying to communicate about overall health. Small changes in routine can make a big difference, but always in conjunction with more comprehensive care focused on kidney health. Swelling. Swelling, or edema, is a common and visible symptom that something is not working well in the kidneys. When the kidneys are damaged, they may have difficulty eliminating excess salt and water from the body, resulting in fluid retention. This manifests mainly in the extremities, such as hands, feet, and face, where swelling becomes evident. For those living with kidney problems, edema is not just a physical inconvenience but also a warning that kidney function is compromised. This swelling can vary from mild to severe, and its presence is a sign that it is time to seek medical advice. To relieve the symptoms, in addition to medical treatment, some simple measures can be adopted, such as elevating the feet while resting, avoiding foods high in sodium, and maintaining strict control over fluid intake. These actions, although simple, can help reduce the discomfort of edema and prevent the worsening of the kidney condition. Understanding swelling as a symptom of something more serious is fundamental for those monitoring kidney health. The body has subtle ways of communicating internal problems, and edema is one of those signs. Ignoring or minimizing this symptom can lead to more serious complications, so it is important to stay alert and act quickly. Taking care of the kidneys means, among other things, paying attention to what the body is saying and taking the necessary steps to protect overall health. Changes in skin color. Changes in skin color are one of the lesser-known but quite revealing signs of kidney problems. When the kidneys are not functioning properly, the buildup of toxins in the blood can result in an abnormal skin coloration, which can range from grayish to yellowish tones. For those who notice these changes, it is a clear indication that the kidneys are not effectively filtering impurities, which may be a symptom of an underlying kidney condition. These changes in skin color, although subtle at first, can become more evident over time, especially in people with chronic kidney disease. It is easy to attribute these changes to other factors, such as aging or sun exposure, but when accompanied by other symptoms, they should be seen as a warning sign. The abnormal skin color is a reflection of the body's internal state, and paying attention to this can help identify kidney problems before they worsen. Taking steps to monitor and treat these changes is essential. This may include regular exams to assess kidney function and, if necessary, adjustments in diet and daily habits to support kidney health. The skin is often the first place where internal problems manifest, and recognizing these signs can be crucial for early detection and proper management of kidney disease. Nail disorders. The nails, often seen as just an aesthetic part of the body, can be a revealing mirror of kidney health. In people with chronic kidney disease, changes in the nails, such as the presence of white bands or the phenomenon of half-and-half nails, half white, half pink, are common and can be a sign that something is wrong internally. These nail disorders do not appear out of nowhere, they are the result of mineral imbalances and other complications associated with kidney problems. These changes in the nails can go unnoticed by those who are not aware of the connection between nail health and kidney function. However, for those living with kidney disease, paying attention to these signs can be an effective way to monitor the progression of the condition. Additionally, taking good care of the nails, keeping them clean and hydrated, can help minimize the visual impact of these disorders, but the main focus should be on internal health. The link between nail appearance and kidney health is yet another example of how the body communicates in a subtle but significant way. Ignoring these signs can result in the silent progression of kidney disease, while observing them and acting promptly can help prevent serious complications. Just like any other symptom, changes in the nails should be seen as an opportunity to assess and improve overall health, especially when it comes to kidney function. Hair disorders. Hair loss is a problem that can have many causes, but when it is associated with kidney health, it takes on special importance. In people with kidney dysfunctions, hair loss can be caused by nutritional deficiencies, hormonal imbalances, or even the side effects of certain medications. Seeing hair fall out in greater quantities can be an alarming sign, not only from an aesthetic point of view but also as an indication that the kidneys are under pressure and not functioning as they should. This connection between the kidneys and hair health is not widely known, but it is crucial for those facing kidney problems. Hair, like skin and nails, can reflect the body's overall health. In the case of the kidneys, when they cannot filter nutrients and toxins adequately, the whole body suffers, and hair is often one of the first to show signs. Maintaining a balanced diet and following medical guidelines to treat kidney problems can help reduce hair loss and improve hair health. For those already noticing hair loss, it is important to adopt a proactive approach. In addition to seeking topical treatments that can help strengthen the hair, it is essential to focus on the root of the problem, which is often related to kidney health. Consulting a doctor and conducting regular exams to monitor kidney function may be the key to controlling hair loss and preventing other associated symptoms. After all, taking care of the kidneys is taking care of the whole body's health, and this includes keeping hair healthy. Throughout this content, you have been guided on a journey of knowledge about kidney health and how it is reflected in seemingly subtle signs from our body. But the real question is, what will you do with all this information? Will you simply ignore it and carry on with life, or will you take control and start applying this knowledge to transform your health? The truth is that changing your life requires more than just knowing, you need to act. So, I challenge you to reflect on what you've learned here and think about how you can apply these insights in your daily life. And, more importantly, don't leave it for later. Your kidney health is a vital aspect of your overall well-being, and taking care of it now can prevent serious complications in the future. And before you go, subscribe to the channel and activate notifications to keep receiving content that will help you keep your kidneys, and your whole body, healthy. After all, knowledge is power, and the more you know, the better you can take care of yourself. Now it's up to you. What will you do with this opportunity to improve your health?